The following is paid for by Advanced Physical Medicine of Miami.
The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
Welcome to Healthy Dose Radio. I am your host, Dr. Joe Gambardella. You can check us out at apmrmiami.com. That's our website. Our office phone number is 305-598-8788. If you have any questions about today's material, call us at our office and we will be happy to answer any of your questions. I'm here today with Rob Sapero. He is our office manager, and we have a special guest, John Gambardella. He is my brother from New Jersey visiting, and he is also a patient and has done many of the services that we have in our office. And we're going to be talking to him today about some of those things. How you doing, John?
Great to be with you. How are you?
Doing great. Rob, you have a topic of interest today, and to a lot of our patients and to a lot of our listeners, it has to do with bioidentical hormones. I'll give you the floor with that.
Yeah, definitely. So as treating patients, as you know, we find out a lot of myths and a lot of half-truths when it comes to bioidentical hormone replacement. A lot of that is due to a lot of media outlets and even individuals within the medical community who have incorrectly portrayed bioidentical hormone replacement as quote-unquote dangerous or not suitable for standard practice. So there's a lot of anti-bioidentical hormone replacement propaganda that has caused many individuals who come into our office to have this bias against it in the beginning. But then once we sit down and we go over some of these myths, then we can kind of debunk it. One of the first ones that I want to talk about and get more information from you, Dr. Joe, is a common one that I hear about, and it's that bioidentical hormone replacement actually increases the risk of cancer. And through a lot of the research that we've studied and that you've learned, you found this to be actually the opposite.
It's a great point, Rob. It's actually probably the most common misconception, and that is absolutely false, that bioidentical hormone replacement therapy is linked to cancer. In fact, there was a study done in as early as 2014, May 2014. It was a 15-year study done at the Kansas City VA, and they tracked people from 1999 to 2014. And the primary outcome of that study, 83,000 people were tracked, and they said that not only did people who took bioidentical hormones to balance out their levels live longer, but they were 56% less likely to die during the follow-up period of all-cause mortality, cancer, heart disease, etc. They were 24% less likely to have a heart attack and 36% less likely to have a stroke.
So not only does it help prevent and actually lessen the risk of cancer, but you're saying also heart disease.
Yeah, if you think of the number 1 and 2 leading causes of death in the United States today, it's heart disease and cancer. And the vast majority of people in the United States are not taking hormones of any kind. And that's the number 1 and leading 2 causes. So adding hormones into the mix is essential on a couple of different levels. Number 1, it's enabling people to get blood work done. And you're finding out what areas that you are suffering from a deficiency. Most people don't have blood work done, but every couple of years, if that. If they go into the hospital, they have an injury, they'll get some measure of blood work done, but it's not the essentials, it's not all of your hormones. And so when we do blood work, just people who get blood work done are going to be healthier in the long run. So we do, the complete blood count, the metabolic panel, the lipid panel. We're looking at testosterone and growth hormone and prolactin, as well as all your different vitamin levels, luteinizing hormone. And you're able to get a clear picture of someone's overall health. The general rule of thumb is this: what is the typical age span where people feel and look their best? If you had to guess.
I would say probably in the early 20s.
Right?
I would agree. I would say early 20s to maybe 25, 26.
Right? That's the peak of athletic performance. Typically, we're at the peak of how good that we look. How many 20 and 25-year-olds do you know who have cancer, heart disease, plaques in their arteries, or are suffering from strokes?
Yeah, not many.
And that's when your hormone levels are the highest. So 18 to 25 levels, when your hormone levels are surging, the inflammation markers in the body are at the absolute lowest. And there's no coincidence that as we age, mid-30s, 30 to 40 is pretty much when we're going to lose 50% of our ability to make testosterone. We're going to lose 50% of that. That mid-30s and 40s is where we start to drop in athletic performance. We start to see changes in our blood panels that reflect high cholesterol. Glucose levels start to elevate. We become insulin resistant, and we start to see markers like hemoglobin A1C become elevated. And that is strongly linked with the decrease in these anti-inflammatory hormones, in particular testosterone.
Yeah, that's true. And then anybody who knows about inflammation in the body knows that it actually can breed cancer in the body. For example, if your prostate is constantly inflamed, and that's a blood test that we check out, we look at your PSA, and if there's constant inflammation, it's just creating an acidic environment where cancer can run rampant.
Yep.
So that's definitely something that we check out. Now, another myth that we hear a lot is that there's actually no difference between bioidentical hormone replacement and synthetic hormones. Can you explain that a little bit?
Yes. So what are bioidenticals? Bioidenticals are the hormones that are already found in our body. So they're the hormones that made us healthy. They're the hormones that keep us healthy. Synthetic hormones are man-made, and they are chemically altered or changed from their bioidentical structure to make them able to be marketed by a pharmaceutical company. So the purpose of creating a synthetic drug is to mimic a hormone that actually occurs in the body, but every single hormone that occurs in the body cannot be sold as a drug by a pharmaceutical company because it is made naturally. In order to sell this and patent it, they have to change the biological or chemical molecular structure. They add different types of esters or chemical compounds to the naturally occurring substance, and it becomes something different. Those are called synthetic. And the body is very smart. It recognizes that synthetic is not the same as man-made. And any type of link that you see with inflammatory conditions, diseases, even different types of cancer are strongly linked to synthetic hormones that are not made in the body.
Yeah, so in other words, if you're out there and you're looking to increase your hormone levels, whatever physician you go to, it being our office or any other office that offers hormone replacement, make sure it's bioidentical. One of those notorious synthetic hormones is Premarin, which was a synthetic estrogen that was causing cancer in women, increasing the chances. And I believe there's a study done in 2007 that showed that. And with that, it kind of created this huge uproar of anti-bioidentical hormone replacement and making people scared.
Yeah, it created something that they called hormone aphobia. One of the doctors that I learned from, and he's a pioneer in the field, is Dr. Abe Morgenthaler out of Harvard University. He was one of the founders of Men's Health Boston, and he's pretty much the preeminent guy in terms of hormone research, testosterone research, prostate cancer as it relates to testosterone deficiency. And yeah, he spoke about testosterone, its role being an anti-inflammatory hormone, but also about this hormone aphobia, about these flawed studies that came out that actually showed that there was any kind of a link between increasing testosterone and different types of cancers. It was actually the opposite for various reasons. For any of our listeners that want more information about those studies, call our office, 305-598-8788, or just simply make an appointment to see us. We can give you the research, go over the information with you so you feel completely comfortable making a decision on how you want to start this program. But the most important thing is, if you are tired, if you are out of energy, if you're constantly getting injured, if you're not sleeping well, if you don't have drive at work, you hate your job, you don't want to work out, chances are you're going to have some sort of a blood work imbalance, and in particular, you're probably going to have a hormonal deficiency. One of the questions I always get asked is, well, what's the most appropriate age to get checked? You know what, Rob, there is not even a specific age anymore. We've seen people that come in their 20s that their hormone levels are crashed, completely low. We've seen people in their 40s, 50s, all the way up. We have patients up in their upper 80s and 90s that are doing really, really well with us. The great part about what we do is we're so connected with the local community of doctors that we co-manage our patients. So all of our patients have primary PCPs, they have their endocrinologists. We refer to our urologist group, who we love. Everybody's getting their exams. So between that and doing the blood work, not only are we reversing the symptoms of low T, people are feeling great, they're looking great, they're working out at the gym, they're getting muscles that they haven't had since they're 20, their body fat is reducing, some down into the single digits. Yeah. And their love life and their relationship at home is better than it's ever been.
Yeah, and another one to kind of go into is, we always talk about bioidentical hormones when it comes to male, but it's just as effective when it comes to female as well, if not better, in my opinion.
Yeah, so and that's one of the things, we talk about low T for men, but it's pretty common that we talk about the M word for females, which is menopause. And it's more out there, it's more in the mainstream, but in terms of the way that it's balanced, it's just kind of let the hormones decrease and learn to live with it. If you get some hot flashes, maybe do something about it, but most of the time, maybe not. Yeah. And then as you start to see your physical appearance deteriorate, right? We get more wrinkles, skin becomes thinner.
The hair becomes thinner.
One of the most common issues that I have women tell me about is that their hair is getting thinner, their ponytails are getting smaller. Mm-hmm. And just as commonly in women as in men is they lose their sex drive. Mm-hmm. But that's very, very hard for women to talk about. Yeah. So that's why a platform like our show, when you're a woman out there who suffers from some of the things or all the things that I have just spoken about, including loss of sex drive, you need to get your hormones checked because you can fix that. Many people are ending relationships because they have lost their drive. And it's just something that can be easily remedied when you check your testosterone levels, when you check your estrogen levels, when you check your progesterone levels, you check your vitamin D levels and find out, number one, are you a candidate? And what's the safe dosage for you to take to get into those healthy ranges.
Yeah, I can't tell you how many couples actually come in together to get their blood work checked, and they both optimize it because, it's one thing just for you to be on bioidentical hormones and to have your hormone levels up to these optimal levels. Sex drive is through the roof, but if your partner doesn't match you, then there's obviously going to be a conflict. And we always encourage them to bring their significant others, and when they do, they're just so thankful. It changes everything about the relationship. Yep. It makes them so much happier, and it's been a great thing that we've been doing. Doc, what would you say to the people who, because it's kind of like a 50-50 split. There's some people out there who believe taking the smallest dosage for the shortest amount of time possible is the correct way to do it. Our philosophy is a little bit different. Can you go into?
Yeah, you know what? First of all, that's probably the least effective way to go about it.
Absolutely.
If I can make an analogy to taking an antibiotic. If you had a really bad infection and you had an antibiotic that was prescribed for a schedule of 7 days, you don't take it for 3 days at half the dose because, number one, the bacteria is going to get acclimated to what you have just taken. It's going to surpass that, and then it's going to come roaring back. So you take all medications, all supplements for the prescribed dosage for as long as you need. Now, for hormone levels, there is nothing, here's another myth, that you could exercise, take great supplements, and have your hormone levels increase to the levels of that when you were 20 years old. And that's one of the biggest myths that we see. There's nothing that you could do. You can't eat your way out of this. You can't take supplements over the counter to bring up your testosterone levels or growth hormone levels to any significant level for a long period of time by doing any of those things. You have to supplement. As your body produces less of these, it is absolutely your responsibility, if you want to live to be 100 and have high performance and have minimal amounts of pain and have high quality function, to get these levels balanced. It's not going to happen by itself.
Yeah.
So if you have testosterone levels, for example, the average testosterone range for men, let's just say, ranges from 250 to 1100. At 250, you're functioning like an older gentleman would. Deterioration of muscle mass, poor cognition, low drive, low energy, inability to perform tasks at a high level. If your testosterone level is 800, 900, or even 1,000, it's the exact opposite of that. So we have men and women who are building muscles in their 50s, 60s, 70s, and beyond because their hormone levels are balanced in their physiological range. Yeah. The most important thing is we're putting people back on the spectrum. We're not putting them at a level far above and beyond what God designed us to have. But if you can match your levels at 70 to when you were 25 or 30, not only on the inside, but on the outside, you're going to look and feel better.
Absolutely. And what I found too is the longer people are actually on it, the better they feel. You know, the longer they have these hormone levels at an optimal level for a year, 2, 3 years, it really shows, you know, especially when you're on it for years and years.
Well, there's actually an exact number, an exact time frame that people need to be on these supplements and bioidenticals to get those results. And we're going to find out what those numbers are and what that time frame is right after this break.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788.
And we're back. So we're going to talk right now about what we were before the break, about what's the exact amount of time that you need to be on bioidenticals to feel the difference. And the exact difference is, the exact time frame for testosterone is you need to be on it for minimum 3 months. Growth hormone peptides, in order for you to thicken your skin, to get deep sleep, to help your joints recover, to build muscle, to get your body fat down to the single digits, you're going to need to be on that anywhere from 3 to 6 months. So it takes time to build a body. It takes time for the body to deteriorate. Be patient and watch the results come.
Yeah, and I think that's one of the biggest keys when it comes to, it's opposite. It's not medicine. Medicine, you take something right away, you feel the effects right away, and it wears off, you know, over time. With these, you're not going to feel the effects the first day you do it, not even the second week, third week, but like you said, 2-3 months down the road is when you really start seeing everything come together. Now, what would you say to people, you know, when they ask, why isn't this prescribed by medical doctors? Why is it not safe? You know, what is the reasoning behind that?
It's not prescribed because it's not something that's taught in medical school. You know, most doctors read lab work by looking at the middle column, which is if something's out of range, they address it. If something is typically in range, they consider that to be normal. And there is a huge difference when evaluating hormones or any type of a blood panel marker between normal and optimal. So, for example, coming back to testosterone, the testosterone range in men goes from anywhere from 250 to 1100. If you're a 25-year-old man and you're under an enormous amount of stress, haven't slept for, say, 72 hours, you're tested late in the day, and you come back with a testosterone level of 400, and you have all the symptoms of fatigue, low energy, and you get that blood panel read, they're going to tell you you're normal because it's in range. But for a 25-year-old male to have those numbers is the farthest thing from normal. There's a difference between normal and optimal, and we look to put people in these ranges in the optimal levels. And that's the key to longevity, that's the key to performance, that's the key to high drive, high libido, all the things that we want out of life.
Yeah. I mean, what I've seen is, you know, Western medicine, they really treat symptoms. They don't treat the cause of why that symptom is there. For example, high cholesterol. High cholesterol is something that people treat. They take statins for it, but that's not treating why that person had high cholesterol to begin with. A lot of it has to do with hormones. Not saying that hormone levels is the cure to high cholesterol, but it definitely plays a role in helping keeping your cholesterol at a good level.
And you know, another reason is because think about the last time you went to your doctor, your medical doctor, and you had blood work done. What was the process for you to get the results of that blood work? How long did it take?
At least 2 visits, 3 visits. It takes 2 weeks.
Over 2 weeks, maybe. Yeah. The majority of our patients tell us they had blood work. They never saw the results.
Yeah.
And so that's another reason. It's not because the doctors don't have good intentions. They do, but it's because they don't have the manpower to do it. It's a lot of work to be able to order the blood work, review the blood work, and be able to present it to the patients in a way that addresses their needs. Multiply that by hundreds of patients, and hardly any doctor's office is going to be able to do that.
Yeah, I mean, we have to have a full-time staff just to manage all the patients that we have. Like you said, ordering it, making sure they're doing their blood work when it needs to be done. It is a full-time job.
So when you do something like this, you're not going to go to somebody who dabbles in this. This is what we do. This is why we are advanced physical medicine and rehab, and we do regenerative medicine and bioidenticals, is because you have to do this the right way. This is not something that you're going to try and, hey, someone in the gym goes to this doctor or this doctor, I can get this off prescription. This is not the way that you do this. If you're going to do something like this, you do it the right way, do it safely, do it effectively. And you know, like we tell all of our patients, we want everyone to live to be 100 plus, and we want high performance, high energy, and we want that type of performance.
Absolutely. I want to put the focus a little bit on John here. John, I know, has been doing hormone replacement with us for quite a while, so he's a perfect example as to what the difference is before and after. John, what were some of the symptoms that you were feeling, you know, when you weren't on the program?
I could tell you that before I started, I was going into work one day, back when I was in my banking world, and my head was hung, and I just felt like I couldn't even walk right. I had no energy, I had nothing, and I just felt like I needed to sit down, maybe get a drink of water. I thought, what the heck is going on with me? I'm in my mid-30s, and I should feel good. I'm in pretty good shape, but I had no energy.
Your eating habits were
my
normal?
eating habits, they weren't great, but they were pretty good.
Yeah.
And I was doing well at work, and my career was going great. However, I just didn't have that same energy, that same drive in the gym, and load up with a lot of pre-workout, and it still didn't work right.
Yeah. And then how long was it after you started the program before you really started to say, okay, yeah, I feel like I'm...
In a short amount of time, I felt like it was a rebirth.
Yeah.
I felt like I was in a situation where I was doing more than I did when I was in my late 20s, early 30s, and now I'm 49, I'll be 50 in a few months, and I can lift more weight and do more things at the gym than I've ever done.
Nice.
And at the end of the day, I asked myself, wow, how the heck am I doing this? And it's through the regenerative medicine and hormone replacement. And if I didn't have that, I don't know where I would be.
It's almost scary to think, huh?
I was just going to say, just to put that into context, you just went back to one of your high school reunions, right?
I did. I went back to one of my high school reunions, and I looked around the room and saw people that had receding hairlines, white hair, gray hair, maybe a year or so older than me, out of shape people that used to play football. And I thought, am I the only one that feels good or looks good? And I could tell you that a lot of these people were great athletes in high school. Mm-hmm. I was a skinny little kid in high school, weighed 168 pounds, and these guys were big, burly guys. And I looked around the room and I said, what happened to these people?
Yeah.
Just to help paint the picture for out there in Radio Land, John is about 6 feet tall and he weighs about 230, most of it muscle. So if you walk by the Dolphins facility right now, I'm sure they drag him in there and say, you can help us. But that's the way it is in the gym. People come up to my brother all the time because he looks great. He's got huge arms, great upper body, and he's consistent with what he does. The reason why this works, it's consistency. You can have all of these products, all of these bioidenticals, but if you don't take it on the proper schedule, if you don't take it consistently, you're not going to get the results. And I know John, when he travels, he takes his supplements with him. Every single night he takes what he's supposed to take, and that's one of the takeaways from today's show is that consistency is the key to longevity.
Yeah. I mean, even if you're not in the Miami area, even across the country, we can take care of you. It's just giving us a call, visiting us on our website, apmrmiami.com. We can send you out a requisition. We can treat you. We would have to have you come in at least one time before we start, but we treat John perfectly, and he's in New Jersey, and we've been doing it for a while now, so... It is
we
possible.
have patients all over the country. We have patients up in Georgia, New Jersey, and so on. Yeah. And it's easy to manage. It's the premium is placed on convenience for the patient. But some of the other things that John, as a 50-year-old or close to 50-year-old, he's a new dad also. Yeah. So he has a beautiful little baby girl, Gianna Rose. You want to say hi to the missus?
Yes. Hi, hey baby and baby. Hey Marisol and Gianna Rose, if you're listening out there. I can tell you, being a new dad, it's a daunting task, and it takes a lot of energy, especially when it's just the three of us and you have no help. And when you have a brand new baby girl, it's all about her. And trying to keep focus and remember what your schedule is supposed to be and when you're supposed to take your hormones and your supplements, and you don't want to miss. So that's tough. And if I wasn't on the program, it would be really tough, because I tell you what, that little girl, she kicks my butt.
Yeah. Oh, just wait. You don't even know what's in store yet.
So for all of you listening out there, if this show hits a chord with you, if you have low energy, low drive, if you want the opposite of those things, if you want to feel better, you're tired of suffering, tired of poor sleep, tired of the job that you have, and you want your life to change, call our office, 305-598-8788. Ask for Dr. Joe. We'll get you some blood work. Everyone who comes in this week, today's date is September 10th, and you mentioned that you heard this show, we're going to test your testosterone levels in the office at no charge, and we're going to let you know exactly on that visit what you are a candidate for. Okay, I want to quickly mention that we are doing a seminar at our office, APMR Miami. It's 7170 Southwest 117th Avenue, Miami, Florida, on bioidentical hormones and regenerative medicine on Saturday, September 21st at 11:30 a.m. Call our office, 305-598-8788. We have limited seats available, so make sure you're one of the first to call. We're looking forward to talking to you next time. Remember, repair, replace, regenerate. I'm Dr. Joe Gambardella as your healthy host. We'll see you next time.